For BTK inhibitors, owning from the first generation covalent ibrutinib to now second generation covalent zanubrutinib and acalabrutinib, we do recognize, or it had been recognized, that there can be cardiac toxicities. Namely, we think of atrial arrhythmias, atrial fibrillation, for example, can occur in patients on these treatments. It is much less incidence with the second generation acala and zanubrutinib versus first generation ibrutinib. We see that in clinical trials, real-world studies, and in 2 head-to-head studies where ibrutinib was compared to zanubrutinib or ibrutinib to acalabrutinib, that the incidence of atrial fibrillation was less. That being said, we know that risk for atrial fibrillation beyond the drugs increases as patients are older. It increases for patients with known underlying structural cardiovascular abnormalities. And so I think in addition to making patients aware that these toxicities can develop, it's helpful to understand prior to patients starting what their individual risk may be. So if patients, for example, haven't had an echocardiogram for a while and their patient is older or have never had one, there are patients where I will obtain that first. I think having a baseline EKG can also be helpful. And then again, reviewing patients' risk beyond the drug for development of atrial arrhythmias. There are also risk for development of hypertension. That can be patients without prior history of hypertension. That can be in patients with hypertension controlled that becomes uncontrolled. That certainly usually doesn't happen overnight. Usually you can tell patients are trending and their blood pressure being higher. And in those cases, in addition, again, to making patients aware that that can happen, I think very close working with either their primary care or their cardiologist is important, so that patients can monitor at home and be seen and follow up so that their cardiologist or PCP can help in adjustment of medications and trying to prevent the continuous increase in blood pressure and prevent adverse events from that perspective of outcomes.